welcome back to Ask a Pharmacist Corner. My name is Marcy again. This week we're gonna talk about allergies, congestion, ear congestion, nose congestion, and runny nose. Before we start, I just want to say that I have a hope and I wish that we go back to our normal daily life. Everything goes back to normal. So this week is about allergy again because of all that's happening this season. Is in this summer, the spring was over and the summer, so we're gonna have a lot of allergies that I see. So everybody comes to me and asks about what do I do about my nose is very swollen, I can't breathe, or I have runny nose and my ears are plugged. So we're gonna start with what I usually tell my customers. What I tell them is based on my experiences. So it's nothing on the book. It's not about what's the products that are available over the counter. I only recommend the products that I think are good and they can do good for the person. So for this nasal congestion and ear congestion or the sinus congestion all together, what I want to tell you is a basic product that I love to use, and I use it myself, and I always tell my customers to use it. And this is a saline solution, and the saline solution, the name of the saline solution is AYR, or air, so it's pronounced as air. So if somebody is congested, first I tell them, if this is a daily thing, the product that I recommend is a saline solution, which is made of salt water. But it's so good, and you just use it whenever you need it or as needed on daily basis. So this is not a product that you only use for a few days and they say, okay, I feel good. You can use it for the entire year, and it has no side effect. The best way to use it, you shake it and close one nostril, spray it straight up into your nose, and then also use it on the other side, close the nostril and spray it up. And once you do that, you squirt it into the nose and then you blow your nose. So wait for a few seconds so that it can go all of your sinuses, and you blow your nose. This is also a moisturizer. Air can come as a solution, it comes as a mist, but also it comes as a moisturizer gel, so that if your nose is dry, if you have a bleeding nose, this is the best thing to use for that as well. So it's a product that I love and I think it works. The other product that's good for congestion is a steroid that is available in the market, and I'm going to tell you what the name of it is. There are a few that are available, but the one of them that is very good over-the-counter medication and you can use it is called Flonase. And the Flonase is a steroid that reduces the swelling. That means it reduces the swelling in your nose, and so you can breathe. Now, Flonase is not used as needed all day, but you can use it as needed if you need it. And also it can be used on daily basis. Flonase is either once a day dosing or twice a day dosing, depending on how you use it. Now, the best way to use the Flonase, it's very important that you pay attention on how to use Flonase. It's totally different from the way we use the saline solution. When you want to use the Flonase, you close the nostril, bend your head down, and you point the Flonase. After you shake it up, you point the Flonase spray toward your cheek. So close your nostril and you spray it toward your cheek. And then you close the other side, bend your head down a little bit, and you spray it toward the other cheek. And this is done this way so that it can travel to all of your sinuses, and the efficiency is better, it works faster, and it's good. Flonase can be used either one spray in each nostril, twice a day, in the morning and in the evening, or once a day, 2 spray at night. So you can use it at night before you go to bed. If you can't breathe, that's what usually I tell my patient. If you cannot breathe at night, this is the best thing to use it. You shake it well. Again, you spray it toward the cheek. Close the nostril, spray it toward your cheeks. That way you get more results faster. Now the other products that are in the market for congestion and runny nose, the one that is very important or most important is Sudafed. Sudafed is a tablet. It's a decongestant tablet that you take on daily basis. If you're congested, sinus congested, ear congested, it's really good for the plugged ear as well. However, my recommendation is only to use it when you need it for 7 to 10 days. Do not use it over 10 days or 7 days actually, because it can cause rebound effect. So that means you get all the symptoms back. Your sinus congestion comes back and you can't breathe if you overuse it. So it cannot be used over, but it can be used for 7 to 10 days, and you give it a break. And then if you need it again, or give it like a holiday break, 2-3 days, and if you need it again, you use it. So Sudafed is very good if you use it correctly. Now, however, Sudafed has some side effect. It can cause jittery, and you can get a little bit jittery, excited. It can make you hyper, nervous even. And if you use it late, it can cause sleeplessness. So my recommendation is never use the Sudafed late after 4 o'clock. So use it during the day, but stop using it before 5 o'clock. It comes as every 4 to 6 hour dose, or 12-hour dose, or 24-hour dose. But my recommendation is always to use it. Get the ones that are every 4 to 6 hours, or the ones that are 12 hours. The 24 hours can make you very nervous because it's a very high dose. Sometimes my patients come to me and tell me, oh, I use Sudafed, but my runny nose has not stopped, and I still have the runners. So a mistake that people miss a lot on this product is that this product is not used for runny nose. It's used only for congestion, but it can cause runny nose. So when you use it by itself, it's not for runny nose. So please don't make a mistake. Sudafed is only a decongestant. It opens up your nose, or it reduces the swelling, so you can breathe. There are also products over the counter that are sprays, and those are basically decongestants, but those are only to be used for 3 days or 4 days. I don't like them that much because it can cause rebound effect, and you can only use it like for 3 days. And if you're really bad, you can use them. And those products, one of them is called Afrin. So if you want to use that, you could, but only for 3 to 4 days. Now, for runny nose, we have products that are antihistamines. And if you remember, I mentioned those for the itchy eyes also, when you have the allergies of the eyes. But if your allergy is not that bad, and you have itchiness of the throat and the nose and a little bit of runny nose, you can use Claritin, which is usually used, the first one to use for allergy and for the weakest kind of allergy. But if your allergy gets bad towards the middle of the summer or even the beginning of the summer, Zyrtec and Allegra are the best products to use. Zyrtec and Allegra, and they have generics available which you can use beside if you don't want to use Zyrtec, and they basically do the same thing. So there's no difference really between the brand and the generic. You can use both of them. Now, before I forget, there is one thing. So we have patients that are on blood pressure medications, and they're so for those, I do not recommend Sudafed, because if they use Sudafed, Sudafed can raise their blood pressure. I always recommend them, for one thing, check with their doctors. But if they want to know, I would tell them to use Mucinex, which is used for chest congestion and for coughing. But the Mucinex can also help to relieve some of the sinus congestion. It breaks up the mucus so that you can use it for the sinuses to break the mucus in your nose. But you can also use the normal saline, which is really good, and it works for that, and it does not raise the blood pressure. And you can also use the Flonase to reduce this the inflammation in your nose. Because it's local, it does not have a lot of systemic effect. So the Flonase can still be used for people who are diabetic or who have blood pressure. So no Sudafed for blood pressure people who have hypertension, because it can make it worse. So please, if you have any question about any of the products that I talked to you about, you can ask me. Meantime, stay safe. You can also give me a comment, and if you have a question about the products, also if you want me to talk about a subject, you can email it to me on marcyrx@yahoo.com, or you can email it to marcyadl@gmail.com. So Marcy, MARCIERX@yahoo.com, or MARCIEADL@gmail.com. And thank you very much, and stay safe. On next session, I have a person who asked me to talk about acid and gas. So next session is on acid, based on acid and gas. Thank you very much, and have a good day.